So where does Deuruxolitinib fit in the treatment of patients with severe alopecia areata? So to review, Deuruxolitinib is a JAK1/2 inhibitor. It's a twice daily drug at a dose of 8 milligrams. It's really wonderful to have this new option. In terms of efficacy, although there's no head-to-head trials between Deuruxolitinib and other JAK inhibitors for alopecia areata, it looks as though the speed and depth of efficacy, meaning not only how fast does your hair grow, but how much of it grows, is very favorable compared to the other drugs, and in fact, maybe the best in class. So where we can use this drug is in a couple of different places. I'll give you a couple of examples of patients that I recently treated with Deuruxolitinib. So if a patient comes to me and they're highly motivated and they want their hair to grow back as fast and as quickly as possible, and they say, what drug gives me the best option for that? Again, although we don't have head-to-head data, at present, Deuruxolitinib would be that medication. The overall data suggests that it works quickly and may work more thoroughly than other drugs. So we would go directly to this drug as a first-line agent, doing it twice a day. To start this medication is very similar to starting other JAK inhibitors with regards to baseline labs, check to make sure they don't have hepatitis, check to make sure they don't have tuberculosis. The one difference is that there's an extra enzyme you have to check. This is a CYP2C9 gene, and this is an enzyme that is used to metabolize Deuruxolitinib. If you are a poor metabolizer of Deuruxolitinib, it means the drug levels may be higher than we anticipate, and it's unclear whether the drug is safe for you. The good news is that Sun, who is a company that makes Deuruxolitinib, has partnered with LabCorp, a national laboratory service, to provide this testing for free. So you can get the instructions on where to go and how to test for that lab and to make sure that your patients aren't charged by contacting Sun, and there's information online for how to do that. So basically, that's the only additional step that you need relative to other medications. But for the highly motivated patient who you feel would be compliant with the twice a day dosing, which most of my patients are, that would be an excellent place to start. A more important place or more common place that you might start Deuruxolitinib is with patients who have tried other JAK inhibitors, but either haven't responded or haven't had a very complete response. So remember, JAK inhibitors can work really slowly, although the primary outcomes in this study were at 24 weeks, and the Deuruxolitinib study were at 24 weeks. Data from other JAK inhibitors has shown that people may continue to grow hair at 52 weeks, even at 104 weeks. So at 2 years, you still haven't gotten to where you want, but you may be improving. 2 years is a very long time, right? If you think about what expectations to set and how eager your patients are to be restored back to how they look and feel. So if you find that your patients have either stalled out, or that when their hair comes back, it's patchy and incomplete, or that you need to continue injections or other treatments to get them to where they want to be, it'd be worth having a conversation to see if this drug would be right to switch to. Remember, anytime you switch a medication, there will be a chance of losing hair, that the medication may not work as well. Another really unique thing about JAK inhibitors in general is that for psoriasis, for example, if somebody failed an IL-23 inhibitor, you wouldn't go to another IL-23 inhibitor. That doesn't make sense. You would switch the class of drug. We don't quite understand why, but for JAK inhibitors, even with JAK inhibitors that have the same listed mechanism of action, for example, Deuruxolitinib and baricitinib are both listed as JAK1/2 inhibitors. Somebody may respond to baricitinib and not to Deuruxolitinib, and vice versa. So if you tried one JAK, you've tried one JAK. It's okay to try another JAK. When you do it, you have to, again, recommit them to being on the medication a long period of time before you see if it works or not. Even when it works fast in this case means 4 to 6 months, you're seeing a difference. That's still slow by any standard we have for atopic dermatitis or psoriasis or any of our other inflammatory skin diseases. I tell my patients that not only do we have to stop the inflammation, but we have to wait for the hair to go back and cycle. So it's a 2-step process before you regrow your hair. So in general, these would be an appropriate medication to try in the setting where patients have had a partial or incomplete or lack of response to another JAK inhibitor as a second-line agent, and for patients who are highly motivated, willing to get the additional testing, and are able to comply with the twice-daily dosing, it'll be a wonderful drug to use first-line as well.